everybody. You are welcome to turn on your cameras. We just want to see your faces. We're not looking to judge you. We just want to see your faces to talk to you and have a conversation this evening. So please feel free. We'll give people just a couple of minutes here to jump on in. Thank you guys for being here today. It's good to see you all. Is anybody excited about the end of the semester?
I am.
You are? Good. We're getting there, right?
I'm with you.
Yeah, I'm with you too. It's been a long one.
Yes.
All right. Well, I think we can go ahead and get started. I don't see anybody else popping into the waiting room, but if they do, we will let them in when they get here. So we can go ahead and get started. So thank you all for coming. We have brought together 4 professionals from the field of clinical psych and counseling to talk to you all about their career journeys and about what it's like to work in the field of clinical psych and counseling. So thank you all for being here. What we will do is we will have each of the panelists go through and do a brief introduction, and then we have some prepared questions. Once we get through those, we will have breakout rooms, and then you guys can choose to go to whoever's room you want to go to talk to them and ask them individual questions. And you're welcome to sort of bop around from room to room if you want to. If you have questions for multiple panelists. And then we'll all come back together, usually right around 5 minutes to 7. I'll pull everybody back in and we'll wrap up, and then we will be done for the evening. Okay? All right. So let's go ahead and get started. I'm going to do just a brief introduction for Dr. Alex Pearl. He will be here. He's just going to be a few minutes late. He was a psychology undergraduate at ASU, so he graduated from the same program that all of you are in. And then he did his PsyD at Midwestern University, and he's currently a clinical psychologist at a group practice, Leviton and Associate Psychological Services, where he does psychological therapy for clients, and his niche is treating adolescents and older people on the autism spectrum. So he does some cool work too. So he'll pop in as soon as he gets out of his prior appointment. So you'll see him come in. So let's start with the other panelists. Kim, I'm going to pick on you just because you happen to be right next to me in the photos.
I love getting picked on. Yay. I'm Kim Palmer. I have my master's in counseling from ASU. I'm a private practice therapist, and I've been doing this for, I don't even know how long. Actually, a long time ago, forever ago, I was one of Carolyn, Dr. Kavanaugh's students. That tells you how old she is. She looks young, but she's. I specialize in trauma, and specifically, I work with victims of human trafficking, rape, all kinds of sexual trauma. I don't know if people know what this is, but I work with people of satanic ritual abuse. And so kind of the heavier topics. And surprisingly, I love my job. And so that's me.
Thank you very much. Zoe, do you want to go next?
Sure. Hi, everyone. I'm Zoe Garza. I graduated with a double major in family and human development and psychology, a great double major if you're interested. My graduate degree is in applied behavioral analysis. My master's is from St. Cloud University in Minnesota. And my current position is a licensed behavior analyst in the state of Arizona. And I work with Ally Pediatric Therapy, which is a ABA clinic here in the Valley. And my focus of my current position is to work with young children, early intervention between 3 and 8 years old on the autism spectrum, teaching them social skills, communication, behavior reduction, and school readiness.
Great, thank you. And Krishma.
Hello. So my name is Karishma. I graduated December 2020. I was also one of Dr. C's students, not so back in the day, but it feels like forever. And oh, I thought my camera was off for a second. I was like, I thought I could see myself. But yes, I graduated also with a double major in psychology and family and human development because they just went so well together. And I finished my master's in clinical mental health counseling from Johns Hopkins. And currently, I'm an associate professional clinical counselor in the Bay Area in California. And I work for a group private practice, and I see like kids, adolescents, and adults. So my youngest is 6 currently, and my oldest is 61. And yeah, I work with a lot of mood disorders. So you have anxiety, depression, bipolar, ADHD, and then I work with people with ADHD or who have had a trauma background as well. And I'm trying to experiment and see how I feel creating a niche as well in South Asian populations, but I haven't decided yet. So yeah, that's just a little bit about me as well.
Thank you. Okay, so our first question is, can you discuss sort of what your career journey has been like? How did you go from being an undergraduate at ASU into sort of the job or the career that you're in now? And is this sort of different than what you thought it was going to be, or is it sort of what you were aiming for to begin with?
Should I go first? I'll go first.
Sure.
My path was pretty straightforward. I did my undergrad at ASU. I did my graduate degree. I will say I took advantage of every research opportunity I could, every TA-ship, anything I could do, because a lot of people kept saying, what do you want to do? And to be honest, I didn't know. I had a theory. I honestly thought I would want to do marriage and family counseling. And when I started to do marriage and family counseling, I know a lot of people love it. I do not. It feels like two little children fighting on my couch. I don't love it. But some people, they're really good at it and they love it. And so I did my undergrad there, my graduate, and then I did court appointed work for City of Tempe for a while. And so I don't know if Tempe still has this, but they had a program where if you got arrested the first time, the judge could sentence you to so many therapy sessions. And you would think if the choice was go to therapy, where you can talk about whatever you want, or go to jail, that people would choose go to therapy. And that is not how it worked. And so I hated it because it made me sad to have to document they're not coming to therapy. And so they would get a warrant put for their arrest. And I hated it. And so I decided I wanted to go just private practice where you want to come, you get to come. And if you don't want to come, you don't come. And I love doing trauma work. And if you would have told me, 20 years ago, I would love to do this, I would have thought you were high on crack. And I love it.
Nice.
I'll go next. It's very, definitely not a huge straightforward line for me, I would say. I feel like you go into psychology and there's so many places you could go, with applied behavior analysis not really being on the top of my list to start, but I found it through my research professor that I work with at ASU. They're huge boats of knowledge. They have so many connections. Definitely ask them all the questions because they got me the internship that brought me into this field I am in now and have the career that I have. Wanted to do school psychology for a while. Saw a lot of assessments, not all to work with kids. not a lot of work with the actual children of the school, and I wanted to be more direct with the kids. So ABA and being a behavior analyst, I get to work with the kids every day, all the time, playing, doing games, social skills, working with families, parents, grandparents, siblings. So I really get to be as direct as possible without just sitting there doing assessments all day. So my path was undergraduate, take a year and a half off to figure out what the heck I wanted to master in. Found ABA. Everyone, that I work with said I was really good at what I did. Pursued that as a master's program and pursued a career in licensure. Fieldwork hours, very similar to psychology. They have fieldwork hours, they have requirements, licensure, testing, all of that stuff. I did the same exact thing. And here I am now, loving all the things and getting to have such a blast every day.
Nice. Yeah, that gap year can be very useful if you're trying to decide what you want. Karishma?
Yeah, I think on the note of knowing what you want to do, it is so important to know what you don't want to do. And I think that was my biggest turning moment. Was I remember I was every semester I would have my chats with Dr. C, like, what am I doing? Where am I going? Like, and I thought that getting a PhD was my way of being a counselor. I didn't even know that I could just get a master's in counseling or clinical mental health and still be a counselor and do what I wanted to do from the start. So I think it was identifying what I didn't like. I didn't like the research aspect. I was part of a research team, did not enjoy it. And that's when I knew that, okay, yes, a PhD is just not my thing. So I would really recommend just having conversations with people who have been in the field, who have experienced something, going on to LinkedIn as well, like finding someone who's doing something very similar to what you might be curious doing, and then just dropping them a message, learning a bit more from them as well. I think that can be very important in understanding what your future is going to be. It's just like what we're doing here. But yes, I think I don't know if this is still a thing, but the first year success coaches, I was one of the first year success coaches, and I think that was something that really helped me as well when I was understanding how I worked with people, how I spoke to people, and also in my interviews in the future when I was like applying for schools, I could rely on the fact that I had done roles which were similar to what I wanted to do in the future. So I think experimenting, having roles that can supplement the work that you're going to do in the future, that can also be very helpful. And one thing that I wish I had known before is think about what you want to do in advance. If possible, have it planned early because there's so much that you need to know in a way, and it's not that readily available in a lot of sense. So doing the research in advance, knowing the accredited bodies that you need to know to get into their program. So for counseling, at least for me, it was CACREP. Those were the programs I needed to look into. So it was having that knowledge and looking into those schools. So I guess it's also a lot of working backwards. That's what I would say. Yeah.
Great. Thank you, Karishma. And Dr. Alex Pearl has joined us. So thank you. Welcome. So the question that we're talking about is just talking a little bit about your career journey and how you sort of made some of the decisions from your undergrad to where you're at now. And is it sort of where you thought you would end up, or is it something totally different than you thought you would end up doing?
Sorry, I just had to get the unmute going. Can everybody hear me okay, by the way? Are we good?
Yeah.
Okay, terrific. I think I did more or less wind up where I intended to. I mean, I think if there's one, maybe, I guess, wrinkle in that particular fabric, it was that I sort of intended from the start to go and working specifically with adolescents, which was, I mean, I still, as far as my educational path, completely unchanged. I got my undergrad at ASU. I think I took a 2-year gap year, and then I got a combined master's and doctorate at Midwestern. And I think it was during my, it was during my postdoc that not even during my internship, it was during my postdoc that I kind of realized, Well, I realized a couple of things. My postdoc was at Gentry Pediatric Services, and then later at Leviton and Associates, which is where I'm at now. And the two big things that I realized was, one, that I work pretty reasonably well with people on the autism spectrum, and two, that I am on the autism spectrum. So kind of that little 1-2 punch of like finding a niche was interesting, because I still work a lot with adolescents, but purely by dint of just sort of being able to interface with, communicate with, and understand this pretty underserved population. Because I work mostly with autistic adolescents and adults, which are a very underserved population. You know, if you're autistic and you're like age 4 to 12, there's plenty of services for you. But you know, if you're over 30, chances are you kind of came from a time where people didn't really understand autism, or that people who are female can be autistic. I got a lot of women who flew completely under the radar on my docket right now, and are really trying to make sense of who they are, you know, what's happened in their social life, you know, why things didn't quite shake out the way they expected. And that one was a pretty vast, actually, yeah, I think it was just because once I got out into the field and started working, it sort of, I mean, that was definitely probably the biggest transformative moment of my career, I think. Does that
Nice.
answer the question? Sorry, I rambled a little
Yeah.
bit.
No, it's all good. Yeah, no, good information. Thank you.
Okay, terrific.
All right, so let's next question, let's think about what skills or knowledge did you learn throughout your time as an undergraduate that you found to be most useful in your career?
I guess I'll start first again. One of the best pieces of advice I got was actually from Dr. C. And I know I say this a lot, but she said to me, you don't get extra points for suffering. And I use that with my clients all the time. Don't make it harder than it has to be. And it's really helpful for people who struggle with codependency and things like that. Like you're not extra good because you suffered more. That's not how it works. And one of the things I did in undergrad that was really helpful is, like I said, I volunteered. So I worked for a year with people on the autism spectrum. I worked with in schools, like elementary schools. I did a lot of volunteer, a lot of research, and I'm so glad I did, because it helped me to figure out what I wanted to do. And it also helped me. One of the things I think a lot of therapists don't know right when they first come out is how to manage your schedule as a therapist. If you are not, let's say that you get, and I learned this in undergrad because I was a teaching assistant and I had to learn how to get people out of the office, have people, cut them off when they need to be cut off. And let's say that I'm a new therapist and I get 5 new clients. And let's say 4 of them are going to process in, we're going to work through, but one of them is going to be someone who needs lifelong therapy and they're going to be difficult. Well, then I get 4 new clients, so now I have 5 again. Eventually, one more of those is going to be that. And if I'm not careful, I'm going to have all my client load be really hard to work with clients who never want to leave, and I'm going to hate my job. So that's one of the things I learned in undergrad, kind of indirectly, but it was super helpful when I got into the real world of how to get people to wrap it up and how to get people to transfer out.
Good, thank you. Yeah, very good skill.
Yeah, time management's huge. There's, especially when you're providing direct care or some type of help, when you have your own clients, every day it takes like an hour and a half sometimes, like reroute your schedule. So I completely agree with that. Another thing I learned is just professionalism. I remember just putting my research professor on a referral without telling her first, and I got a very very professional conversation that I had with her about professionalism and how to go about communicating that to your colleagues, to your, supervisors, all of that kind of stuff. So I learned a lot about professionalism and communication with your colleagues and your superiors in undergrad. And it really helped me coach the people I work with. I work with a lot of new people in the workplace, 20 years old, 21 years old, 19 years old, who maybe didn't get to develop those skills in college. So working on professionalism and communication is huge because it's going to go with you throughout the rest of your career, and it could it could burn some bridges if you don't do the right things. So, if you ever have any questions or know how to, have questions on how to ask or respond to an email, reach out to your professors, reach out to your colleagues, because it can really burn some bridges if you say or do the wrong things.
I think the one thing that really stands out to me was in my role as a first year success coach, one of the biggest things was you would have students come in back to back. And back then it was like, oh, that's a lot to like, okay, someone's come in. I have to be a brand new person when they walk in the door. I have to leave everything that I might be facing outside, and I need to leave everything that the previous student has just told me aside as well. So that was one of the biggest skills that I have to apply now as well, is that when you open your door to come to work, that's when you leave yourself behind, all your own worries behind, and then you're there with your clients, you're there with your students. And then when you leave work, it's you leave work behind. And then you go back home and you do your self-care, and the importance of self-care as well. Yes, the boundaries, the boundaries aspect is so important. Because regardless of what field it is, in this field itself, you give so much of you. And you need to find that time to build yourself back up again. Regardless of what you do in your own time, your personal care, you need to make sure that you have all of your energy, your cup is full so that you can go and help others. So I think that was one of the biggest things that I took away from that one role that I had in my undergrad and that I still use. And honestly, I use that in my interviews now as well. I was like, look, I've done this before. Like when I had to land my first job, I was like, I've done this before. I know what it's like to leave my emotions from one student to the other, and I know I will be able to do this again, and I know the importance of self-care. So yeah, I think that would be my big thing that I learned through that time.
Great, thank you. And Alex?
Oh, I think that at ASU, I think one of the biggest virtues that ASU has available to it is the diversity of programs that you have access to. And I think a lot of that is because like my two, I think, big moments was first, I guess I got to like work in a research lab while I was at ASU that I had a whale of a time at. It was researching like envy, the effects and the nature of envy, different types of envy, like constructive and destructive, which was fascinating. But and like not only was it really cool, but I also got to learn how to work on a team. I got to work. I have no interest in research whatsoever. I only wanted to do the counseling and therapy stuff, but it was still, I still had to get into grad school, which, meant that I still needed to learn research methods. So it was wonderful. And then on the other end of that, I was at the Barrett Honors College, and one of the like prime classes is a little silly, but one of the prime classes for understanding the ins and outs of writing a scholarly paper was in my honors human sexuality course. We had some really high expectations for the papers that we were supposed to cobble together, the scholarly sources we were supposed to use. And I think I took it in my sophomore year, and that kind of primed me for God, all the way up to my graduate career. It was hugely instructive. So I think if there's one thing I can like tell to students at ASU studying psychology, it's that you have an outstanding wealth of resources at your fingertips. And that is not available to everybody who studies psychology. Like that is probably one of ASU's biggest virtues, I think.
Nice, thank you. All right, let's talk a little bit about sort of what are the rewarding aspects of your career? What are some of the things that really excite you about the career that you've chosen, and what you do on a daily basis? And sort of what are the things that really make this something that you want to continue doing? Kim, do you want to start us off?
Yeah. So I think my biggest reward is because I deal with a heavier trauma group, I get to see real life changes. Like, I have the most fascinating job. Like, I hear every dark secret in the whole wide world. My job is way better than CSI or Law and Order. Like, it's fascinating. And I get to see these people who have been through these horrific things function. They'll come into my office and we'll be at a point where I have to say really hard things because not only have they been through trauma, but trauma will stunt development. So I will have to say things like, sweetie, I tell you this because I love you, but you smell really bad. And we need to talk about how you didn't learn basic hygiene. And they'll go from that to in 8 months getting their doctorate somewhere. Like it's just crazy how functional they become, or like, maybe like enrolling in college for the first time. And it is the most rewarding thing outside of having my family that I've ever done. And the other thing I really love is that our field of psychology is constantly growing. We're constantly learning new things about the brain, and so I can constantly update my skill set. And I think it's one of the few fields where you can, like, in 10 years, I will be doing totally different stuff than I'm doing now because it will grow so much. And I want to add one more thing. Someone had talked about boundaries. Sorry, this isn't part of the question, but I'll make it real quick. One of the things I hear people say a lot as a therapist is they'll say, I'm a paid friend. And I really disagree with that because my friends can talk to me anytime. My friends can reach out to me at 2 o'clock in the morning. That is not how a client works. And I wouldn't say some of the things to my friends that I say to my clients. I have to be really direct with my clients. I'm a therapist and I really care about the people that I work with. But if I think of myself as a paid friend, then I won't be able to do some of the hard conversations I need to have with them. And so that's one thing I see a lot of therapists say, well, I don't want to hurt their feelings. And I always say, it's not that I want to hurt your feelings, but I'm being paid to help you and to have the hard conversations. And you can have really hard conversations in a really loving, kind way. But that's my job. That makes sense?
Yeah, I love that distinction. Yeah, that clarifies it. Thank you. Zoe?
I like that we're in this order now. It makes me feel prepared and predictable. I see you, Alex, also nodding your head. I like predictability as well. There's so many rewarding things about my job. It's being able to help parents who are suffering, who don't know how to help their kids take a bath independently. Having a kid make their first friend. Having a kid be excited about learning for once, and get excited that they did something on their own and independently. Working with just educating on the neurodivergent movement, right? Understanding what autism is and educating others and encouraging others to educate on what that is and what stemming is, right? What that means and how it regulates others, and letting parents have this big boom moment of what neurodiversity means, I think has been one of the most rewarding parts of my job, and letting parents feel comfortable about educating others of what that looks like to support their kid. A lot of the kiddos I work with are non-vocal verbal, meaning they have no vocal language. Doesn't mean they can't communicate, right? But being able for them to have the ability to advocate for themselves, to say no, to say stop, to say I don't like that. I don't want to do that. So I think just seeing kids being able to rise to their own strengths and have that autonomy, and working with families on being able to support them and feel good about where their kids at, I think is probably the most rewarding part of my job.
I just want to echo so much of that. But yeah, absolutely. I think one thing that Kimberly said is like, we have to be direct with them. And I think one thing that I've mentioned in the past as well to people who I work with, but it's like I would be doing a disservice to my clients if I let things slide, if I don't challenge them in the moment, if I don't make them reflect on the fact that, oh, wait, this fight with my friend might have actually been my fault. That those are some big realizations because it's not always the other person who might have made a mistake. But I think overall, some of the biggest rewarding things is knowing that you're making a change every time, like you're making even the smallest impact every time that person walks into the room. Even if it's just some psychoeducation, even if it's just helping them feel seen, like helping them know that they're not alone, that a lot of people face anxiety, a lot of people have ADHD. A lot of people are in the same boat, and you're not alone doing this because sometimes we don't talk about these things with our friends necessarily. And it's so isolating for so many people. And overall, it's just when the time has passed and your clients are like, I think I'm good. I don't want to, like, I don't think I need to be coming in anymore. And they break down crying, like, thanking you. We are taught that you immediately put it back on them. It's not about us, it's about them. So we have to divert that. But in that moment, letting it in afterwards for me to be like, okay, I did make a change. Like, this is why I'm doing this. And I think 2 months ago, when I saw one of my kiddos, when they were leaving, they told their parents, they're like, this went well, didn't it? And then it was just so cute to just hear that. I was like, okay, it went well. I guess it did. So it's the little things. It's seeing them excited to come in, knowing that they can, sometimes you're the only one they can actually share how they're feeling with. You're like someone who can actually tell them that, yeah, I know you're having boy troubles and you can't tell your parents, let's talk about this. So it's those things, knowing that for me, it's knowing that I'm the person that I wish I had. So I think that's my biggest rewarding moment in this field. So yeah.
Yeah, that's cool. Alex?
There we go. I think I touched on this during my big first like ramble fest when I introduced myself, but and Zoe also pointed this out as well. There are since I treat so many people, like so many older people on the autism spectrum, even just, there is a weird trend just about being neurodivergent in general and growing up not knowing that you're neurodivergent and just thinking that you're weird and bad. Um, and kind of first off, just the solidarity piece of being with them and being like, well, no, your brain's literally structured differently. Like we can talk about synaptic pruning, we can talk about, GABA deficits and, glutamate excesses and stuff like that. We can talk about communication deficits, other skills that you might be struggling with. But at the end of the day, you're not this like horrible person that everybody left because, there's something wrong with you. You're just, a person who's a little bit different. And, let's talk about picking up the pieces. Because not only do you get to change how they think about themselves in the present, but they also kind of get to forgive themselves for stuff that happened to them in the past. Which I have. I mean, I guess that's rewarding for me because I get to, that helps with like a big longitudinal change. But it's also, I very much like to see it happen for them because you don't always get that working with like a neurotypical population. I mean, I love my neurotypical clients, and I've for some reason seen some really weird successes working with like 30 to 60-year-old white men. I don't know why talking with them has just gotten really just gangbusters for me in the past. Those are like my quickest out the door. But no, it's just having like seeing it click on, like a 30-year-old, autistic man's face of like, oh wait, like I'm not actually bad. There isn't like just because I'm the common factor in all this other horrible stuff that's happened to me, that doesn't mean that like I'm the bad one. Like, um, and I think that's kind of led to some powerful moments, and it's been really cool to watch.
Nice. yeah, you guys, it's hard work, but rewarding work. And so I think it's a cool profession to get into. Okay, so now I want to make sure that you guys have time to ask your individual questions. So I am going to, let me open up all the rooms. So I'm going to open up the breakout rooms and ask Kim and Zoe and Krishma and Alex to navigate into their specific room with their name on it. And then all of the students who are here can choose a room and go into that room as well. And then you can ask your individual questions regarding what they're doing and what your goals are and any questions that you have. And we will have someone in there to assist so that you can keep the conversation. They'll help keep the conversation going, okay? Then I'll bring everybody back a few minutes before 7. Sound good? Okay,
Yep.
so if you guys want to go ahead and navigate over to your room.